if you look back at where the goals of the value-based care movement have been, it's been about getting providers into APMs. Well, it's not really, the goal shouldn't be to get providers in APMs if that doesn't result in better care for patients. So I think what we're trying to do is turn this a little bit back onto the patient and say what's really important is for that patient to receive coordinated care in a way that leads to better outcomes, and more attention to the conditions that they're facing, thinking about the outcomes that are important to them, and the quality metrics that matter to patients. And as we were undertaking this, strategy, we realized that we had, and I guess just as you characterized, we spend a lot of time talking to providers, to health systems, to payers and purchasers and states, but we have not spent a lot of time talking to patients. And so we actually did focus groups around where we were leading with the strategy, and the terms don't mean that much to patients or to beneficiaries. It, accountable care, health equity, like we talk about these things in the way that isn't really meaningful to patients. So I think not only do we have to incorporate what's meaningful to patients in the way that we're doing our work, but we also have to be able to explain what we're doing in terms that people can relate to. Wouldn't you be happier if someone was paying attention to you after you left the hospital to make sure that you had home care if you needed it, that you were making follow-up appointments, that you were taking the medications, that all of this is really geared to putting the patient at the center of care, which I think is what providers were trained to do. So hopefully this brings them all back to where they felt like they were moving in the first place when they decided to take up a career in medicine and healthcare.